Washing your hands is critical. Washing your hands multiple times throughout the day works well, using warm soap and water, and if soap and water are not available, using alcohol-based hand gel. And also, an important message, please, if you are feeling sick, stay home from work or school. We have been working to communicate to businesses and schools how important this message is so that everyone can be supported in being able to do that. I want to reiterate it now so that everyone can hear. If you're not feeling well, just stay home. That's in advance of running to a healthcare facility. If you feel like you're okay to stay home when you're not feeling well, that is the best place for you to be. Coughing and sneezing into your arm or tissue is also critical. If you've not received your flu shot, this is an opportunity to do that as well. Not because the flu shot protects against COVID-19, but the flu shot helps decrease your risk of needing to go to the hospital with the flu if you develop severe symptoms. The flu shot is also helpful for protecting the people who are around you against the flu. We need to keep everyone as healthy as possible. Another key reminder is that masks are not recommended for people in the general public who are healthy. Wearing a mask is primarily reserved for a healthcare provider or someone who has symptoms, and if they are ill. Masks are usually to prevent the spread of illness that already exists. Someone who is well, the CDC does not say that there is any benefit in wearing a mask. And a key component is we want to be able to preserve masks to make sure that they are available for the healthcare providers who will need them. Finally, it's very important that people know when to go to a hospital emergency department and when not to.
Governor, from a basic milk and bread standpoint, what does the average Rhode Islander need to do to be prepared for this, whether it's supplies or plans? What should everyone be doing starting right now?
Washing your hands several times a day. Avoiding, just be smart about it. Be smart about it. So if you feel sick, stay home. If your kids feel sick, keep them home from school. If you are, starting to feel very sick, call your physician. We want to be smart about this. We don't want people to be panicked. There is no need for panic. You just want to use some common sense. And the most important thing, as has been said, is stay home if you're not feeling well. This morning, like a lot of Rhode Islanders, I went to Mass. So use common sense. Wash your hands after Mass. If you sneeze, sneeze into a sleeve, sneeze into a Kleenex. In terms of milk and bread and supplies, it isn't at that stage. It's just, at this point, stay informed. This is going to change day by day. Stay informed. Be smart about washing your hands. And if you don't feel well, keep yourself at home. And call your physician. Don't run to the emergency room. Just, behave as you would in any other circumstance if you're not feeling well.
Director, does your testing protocol differ from the CDC's? You said this was treated as a presumptive positive, and yet you needed verification from the CDC. How do they differ? And going forward, do you have the capability to verify that someone is infected?
This is the same process that every state is using throughout the country. Because this is a new test that we are all using on a novel virus, we are running the same test that the CDC is again repeating. And that's the protocol that they have asked for, and that's what we are doing.
Are there enough tests? There seems to be a shortage of tests nationwide. In fact, as of yesterday, the report was only 500 people in the country have been tested for this.
There are enough tests thanks to the leadership of our state health laboratories with Dr. King. But we want to be judicious in how we're approaching it, which is why we have a system that's set up where we are determining in collaboration with the healthcare provider when it's appropriate to use the test and when not to. This is something that's an important element because prior to this happening, the CDC was conducting all of the tests for Rhode Island because of the challenges that were happening. But as mentioned, our state health laboratory has been working diligently to build the capacity for it, and we're able to expedite it this weekend so that we could identify this case here in Rhode Island.
Director, you said in the release that if someone was not showing symptoms, if they've been exposed to an individual outside their home setting, the virus cannot spread to people in the community. So you're saying if someone is not showing any symptoms but might have been exposed, that it can't spread?
Correct. Based on the information that we have today and based on our communications with the CDC, how we are approaching it is only making a change or doing testing if someone has symptoms. If they do not have symptoms, they are not considered someone who is at high risk of spreading the infection. So that's an important message, and it's also why we said it is unlikely for you to get infected if you are exposed to the contact of a contact. You need to be exposed to someone who actually has symptoms.
How many people are now being monitored? How many people on self-quarantine are now in total? You had 40 people with this person, and is that in addition to the 26?
That's in addition.
So,
in terms of how many have been tested, Doctor?
We are following the protocol that has been recommended and is being pushed out through the CDC, which connects to only testing people who have symptoms. If you do not have symptoms, we are working with people closely to make sure they are monitoring themselves for symptoms and then treating them differently. But if they have not had symptoms, we are not testing, and that's what's happening across the country.
How many have been tested? Protocol, excuse me, in terms of the protocol for frontline healthcare workers, have you given new instructions to hospitals or emergency rooms or nursing homes about what they should be doing?
We are working very closely with the healthcare facilities throughout the state. The message is evolving as the CDC and others learn more, and so we're doing what we can to make sure that that message is pushed out to all of our healthcare partners who have been responsive and are doing everything they can with this very evolving situation.
Director, right now there's a finite number of tests. Are these tests exclusively for Rhode Islanders? In other words, another state, the CDC, couldn't utilize the physical tests that you're describing right now?
Thanks to our RIDO State Health Laboratories, we have the tests that we need for Rhode Islanders. And we're going to monitor that system so that we can respond the way we need to.
Are you
How many have
able
been
to give us
tested?
the
How
identity of particular school districts in relation to this most recent case? And can you elaborate on which communities might be more directly impacted by this particular case of coronavirus?
We are working with all of the sectors that we need to throughout the state. The message is the same in terms of being able to stay home if you're ill. So that means businesses, that means schools as well, faith-based institutions. We want to help make sure that everyone has the information that they need. If you are ill, stay home. Symptoms are what's required in order to actually spread the infection. So if someone is out and does not have symptoms, the risk of spreading throughout the community is lower. And that's why it's important to monitor for people, which is the message that we are giving to people who have traveled to places where COVID-19 is prevalent.
How many people have been tested? How many people have been tested in total?
Why not answer that question, Doctor? How many people have been tested?
That situation is continuing to evolve. We are focusing on testing the people who have symptoms. So we are
12,
connecting with them. No, it's not a large number at this time.
What if the person went to came back from the trip on the 22nd? When did he or she? And can you tell it's he or she? I mean, that's not. We'll respect the privacy, but the Boston case, we know it was a man
In their 40s.
in the 40s. A man or a woman?
It's a man.
Man. And when did he